Hello everyone, welcome back to another video. Today we will discuss the most common cancer in women, breast cancer. About 1 in 8 women will develop breast cancer in their lifetimes. The topic is so vast, there are many new treatment options available in the last few years, so it is impossible to cover all of them in a single video. I'll divide this topic into 4 separate videos. In the first video, we will discuss the basics, warning signs, and various tests used to diagnose breast cancer. In the next 3 videos, we will discuss the treatment options. By the end of the series, you'll have a clear idea of breast cancer and what you need to know as a patient or as a caregiver. Let's get started. To understand breast cancer, let's start with some basic anatomy. The breast has 4 main parts: lobules, ducts, fatty tissue, and lymph nodes. Lobules are small glands that produce milk. Ducts carry milk from the lobules to the nipple. Fatty tissue gives shape to the breast, and lymph nodes help remove waste and fight infections. Most breast cancers arise from the ducts or the lobules, so they are called ductal or lobular cancers. But the treatment does not depend on this. Treatment mainly depends on the molecular subtype, which is based on certain proteins found on these cancer cells. Hormone positive cancers grow in response to estrogen or progesterone, which are female hormones. HER2 positive cancers have too much of a protein called HER2, which makes the cancer cells grow faster. Triple negative breast cancer, or TNBC, does not have estrogen, progesterone, or HER2 receptors. That is why it is called triple negative. Like I mentioned before, each subtype behaves differently and responds to different treatments. Breast cancer is most commonly seen in women, but even men can develop breast cancer from the breast tissue on their chests. Having a family history of breast or ovarian cancer raises the chance of developing breast cancer. If you have certain genetic mutations like BRCA1 or 2, your risk increases significantly. There are many things you can do to reduce your risk. Maintain a healthy weight, as being overweight raises your risk. Exercising regularly can lower your risk. Stop alcohol. The more alcohol you drink, the higher your risk of breast cancer. Even small amounts of alcohol can increase this risk. Long-term hormone therapy can increase your risk. So discuss the risks and benefits with your doctor if you are considering hormone therapy at menopause. Breast cancer often starts quietly, so it's important to know the warning signs. The most common sign is a lump in the breast or underarm. There can be changes in skin like redness or wrinkling of the skin. There may be a bloody discharge from the nipple, or the nipple may turn inwards. If you notice any of these changes, see your doctor right away. Many people think cancer always comes with pain, but this is not true. Pain is not an early sign of breast cancer. Most early cancers are actually painless. Early stage breast cancer is curable, which is why screening is so important. Screening is recommended after 40 to 45 years of age, and mammogram is the most common method used for screening. It uses low dose X rays to look for tumors before the symptoms appear. It is usually done every 1 to 2 years. If a woman under 40 notices a breast lump, an ultrasound is often used because younger women tend to have denser breast tissue and mammogram is not a good tool for them. If something suspicious is seen on a USG or mammo, the next step is a biopsy. With the biopsy, a small tissue sample is taken to confirm whether the cells are cancerous. Fine needle aspiration cytology, or FNAC, is usually not performed for diagnosing breast cancer because it does not give enough information about the molecular subtype. And like I mentioned before, molecular subtype is important to plan treatment. The treatment depends on the cancer subtype and stage, meaning how far it has spread. Hormone positive, HER2 positive, and triple negative breast cancers are treated differently. Treatment options include surgery, chemotherapy, radiotherapy, hormone therapy, targeted therapy, and immunotherapy. We will discuss all these treatment modalities in detail in the next 3 videos. In summary, breast cancer is the most common cancer among women, and the 3 main subtypes are hormone positive, HER2 positive, and triple negative. Each behaves differently and requires different treatments. Both women and men can develop breast cancer. Risk increases with family history, BRCA mutations, obesity, alcohol use, and long-term hormone therapy. Exercise helps to reduce risk. Warning signs include a lump in the breast or underarm, skin changes, and nipple discharge. Most early breast cancers are painless. Early detection is the key. Mammograms start around age 40. Ultrasound is used for younger women with lumps and biopsy for any suspicious finding. Thank you for your time. If you found the video informative, please share it with your family and friends. If you are new here, please check out my other videos and subscribe to the channel. We will discuss the treatment options for hormone-positive breast cancer in the coming week. Until then, take care.